30-year-old transgender patient. We're doing gender-affirming surgery, 360, fat transfer, feminization. Additionally, we're showing something that we haven't put on media before, which is the remodeling of the ribs. We'll go into more detail what that is. One liner is we're going to fracture the ribs. We're not going to use any fixation. I'll explain what that is later. And by fracturing part of the rib and corsetting afterwards, we can achieve a more feminine waistline. All right, we're gonna do expansion of the thigh. So the thigh is gonna come out. We're gonna bring in the waist and we're gonna do a little high def. And what you'll see a big difference at the end is once we do the rib remodeling, we're gonna see particularly here, the inflection point is gonna come in. So it's gonna narrow the waist further by manipulating the bony framework. Alright, gender-affirming surgery, 360 fat transfer. She has a good shape already. I'm going to highlight it, refine it a little bit more by bringing in the waist, expansion of the hips. We're doing our typical 360 from top to bottom, lipoing everything. And after this portion of the case, we'll be doing the rib remodeling. I remember she had a good shape, so we lipoed everything, upper back to waist, small pinch in the waistline, maximum expansion of the hips and thighs. Alright, so this is a thorax or rib cage of a patient who we're doing rib remodeling. She actually has 11 ribs. 1, 2, 3, 4, 5, 6, 7, 8, 9, and there's 10 and 11 up there. What we do is we measure from here to here about 8 or 10 centimeters, and then once we pick our spot, we go down with a needle, and then when we get down with a needle, we use something to start cutting into the bone. Once we cut enough into the bone, we then come out distal or lateral over here. We push down. Once we push down here, wherever that cut was made, it'll crack and form an angulation in the bone. So it's done to the lower 3 ribs, but because she has 11, we're going to do it to the lower 2 here. Alright, so these are the 2 puncture marks for the ribs. We broke the lower 2 ribs. You can see how much the waist is coming in. There's the upper border of the 9th rib. This particular patient had 11 ribs per side, so you can see here how much the waist came in. So recap 360, fat transfer, patient's transgender. We also did rib remodeling, so we focused a lot on that content. Again, the way it works is we use an 18 gauge needle, go down to bone, then we cut surface of the bone, we push in to break. When it breaks, it creates an angulation in the waist, and then we corset the patient for several months. Surgery time is about 4 hours. Final results, again, usually 2 to 3 months. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.